Good morning, everyone. My name is Percy Turner. I am working with the Community Engagement Center in conjunction with our KDADS team as part of Community Connections. We are representing Community Connections today in our second of 3 question and answer session with providers. Basically, we are here to help people work through remediation and heightened scrutiny so that we can move on to our next phase, the ongoing monitoring phase. With me today are representatives of the review team. Russell Bowles is here. A coworker of mine, Zane May, and Sarah Sammer are also here for some technical assistance if people are having just some issues with accessing the Community Connections website or navigating through the remediation or heightened scrutiny menus. Russell will also be doing some of the heavy lifting in representation of the heightened scrutiny team. He will give small updates regarding both remediation and heightened scrutiny, and then we will move on to questions from you all. A word about questions. Because we are expecting to have a fair amount of people, we'd like to keep it as organized as possible. If you are on the computer, we ask that you use the raise hand function. You can find that function under reactions if you have it, so it should be on your bottom menu. If you click the reaction, it's a smiley face with a plus button over it. Great, thank you, Latanya. I'll add that in. So if you see the smiley face with the plus over it, if you click on reactions, there's a bottom bar that says raise hand under it. Again, this is if you have the most recent version of Zoom installed. If you do not, you might have to go to the participant list. That is the second option. It's a group of people. If you click on that, you should be able to find your name, and then under the options there, you should be able to click raise hand. Again, this works if you are on the computer. You raise your hand, I will acknowledge you, and you will ask your question. I will lower your hand for you. You need do nothing more. If you are on the phone, which we have a number of folks connected via phone, you can unmute your line by hitting *6. So if you have a question, unmute your line, state your name, I will acknowledge you, then you can ask your question, and then I will go ahead and mute your line again. For all intents and purposes, please also use your phone's mute function if you have one, just in case the computer forgets it's a computer. We don't want to be privy to your background, as I'm sure that you don't want anybody to be privy to whatever is going on in your life. So, having all of that said, while I was doing the talking and stalling for my compatriots to enter, it seems we have also Colin Rourke, who is a representative of the heightened scrutiny team. He is the heightened scrutiny team director, and Latanya Wright, who is our communications person as well, representing from KDAD. She's the one who puts a lot of these trainings together and has a lot of direct contact with providers. So Colin is going to be giving an update regarding heightened scrutiny. Russell will be giving an update regarding remediation, and then we'll get into our questions. Russ, you want to start us off?
Absolutely, I can do that now. Thank you. My name is Russell Bowles. I am the Remediation Desk Review Director for this project on Community Connections. And I would like to welcome everybody for attending. I'd like to start off and basically go over the website, let everybody know, and Zane, can you put in chat the website so everybody has the address, and then I'll go ahead and say it for those on the phone. We work out of communityconnections.ks.org. That is where everything final rule lives, so that we can go through this process towards compliance and taking that walk for the state of Kansas to meet compliance with the final rule. So with that, first I would like to talk about the website and some of the things that it has. If you open up the, in your time, if you go and you open up the website, on the very first page or the home page of that, at the top, there are a list of tabs. One of those tabs is called Remediation Resources. And with it, it has a lot of information on how to remediate, what makes good evidence, kind of the guideline for what the questions we're asking and what type of evidence is being asked to be provided to meet that road to compliance with that. And with that, I would also like to say that a lot of that evidence has come from working with CMS through this project, working with providers through this project, re-looking at the assessment, and actually doing remediation. So we have looked at over 100,000 pieces of evidence just to get people to the remediation process. And now that we are in the remediation process, we have looked at, we're getting close to looking at over 50,000 pieces of evidence. So, you know, we're finding new things all the time. But again, our resources to go through that process, and we update that to keep you guys updated. What is remediation? Remediation is a process for assessing settings to submit evidence to come into compliance with the final settings rule. And that process to meet the final settings rule in Kansas was the assessment was originally submitted back in the winter of 2019, 2020. Assessments were reviewed and settings notified of what questions need remediated. And then each notified setting completes a strategy for each question. And we can kind of go through, if you have questions about that, we'll talk a little more about that. Each setting uploads new evidence for each question in remediation. Each question is reviewed for compliance, and then each question not compliant is sent an email describing what was good and what still needs worked. If it was compliant, you will receive an email saying that that question was determined to be compliant. And then settings continue this process until all questions are compliant. With that, I do want to reiterate and state that remediation and heightened scrutiny are able to be done concurrently. So even if you have been asked to undergo an on-site, please continue remediating through the Remediation tab. And you can complete those questions until those are all compliant. So with that, we do have a date of July 1st where we would like to see all questions for heightened scrutiny category 3 come in so that we can review those, and hopefully we can work through the process to get those compliant to avoid any further review or submission to CMS for that. And Colin will talk a little more on that. So again, those resources, if you need to know anything about the final rule, it will be on the home page of Community Connections. So you can go about the final rule, look at that. It'll give you a lot of information. Remediation process and what evidence lies in the tab under Remediation Resources. Two main ones that we really like to focus on for remediation is the very first one that will pop down in the list is evidence guidance. And then as you go down, provider remediation handbook, that will also help you get through the process to get to the remediation tab and how to access and upload the process to access and upload evidence through the remediation tab. So with that, I would like to turn it over to Colin Rourke.
Thank you. I'll get it off mute. And good morning, everybody. Yeah, I'd just like to add on to what Russell was talking about and just start with that 7/1 of 2021 date for Category 3 only settings. So that date, if you remediate everything by that time, you will not require additional heightened scrutiny review, and that heightened scrutiny designation will be removed. After that date, if a setting does not remediate, they will be provided on a list considering that they are willing and able and are participating in the process. They'll be provided on a list to CMS who will sample that, and then we'll have to provide additional information as to why we believe these settings can and will overcome by the 2023 deadline.
Okay.
I think Colin might have froze.
Yeah, it does look like he is doing the greatest mannequin challenge. We're going to give Colin a minute. In the meantime, well, hopefully Colin gets himself either unfrozen or drops and rejoins. I do want to remind people of our question and answer etiquette. If you're on the computer, you will use the raise hand function. If for whatever reason you're unable to find that function, or if it's not working for you, you can just type in the chat. It looks like Colin has left us. He'll be back here in a moment. You can type your questions in chat. Myself and Zane will be monitoring chat to ensure that everybody's questions get answered. We will do our best to kind of answer all of these questions in the order at which they are received. The meeting is also being recorded, just so you're aware that recording will be put on the Community Connections website for your reference and for the references of those who were not able to make it today. Registration for our next meeting is full. If you have somebody interested in more of these type of sessions, please go ahead and contact our chat at communityconnectionsks.org. So that we can begin recording requests. Having that said, Russell, do you think that you could help finish out Colin's update? Do you want to wait for Colin? Oh, looks like he just rejoined. So welcome back. You're fine.
Had to reset the Wi-Fi real quick, and I'll just leave video off just in case, make sure I don't freeze. Anyways, where I was at was in regards to the Category 3s. So as I was saying, those who've been participating, it is a definite task that is able to be completed by getting those remediations in and having that designation removed. So just continuing on the remediation process and ensuring that the submissions and working with Russell and his team is the best route to having that designation removed. And just as a reminder and to reiterate, even if your setting cannot and does not meet that deadline, you will still continue with the remediation strategies and continue the implementation of that. But your setting will have to come under additional scrutiny and will be included on that heightened scrutiny list. As I say that, I also want to reiterate that heightened scrutiny isn't necessarily a bad thing. It's mainly due to the location of the setting. So having a heightened scrutiny designation isn't necessarily a red flag, I mean, in that sense, but more we have to take a closer look and gather evidence to determine the setting's level of compliance. So the main thing, the heightened scrutiny team is conducting those virtual and on-site assessments to gather that information through interviews with staff, executive directors, and individuals served. And what we're doing is determining the level of compliance, and if there and identifying areas that require updates to come into compliance. And at the time that we are there and completing the assessment, we'll work with you to come up with a plan for areas of non-compliance, and you'll just have to include a plan with timelines. So the heightened scrutiny team continues conducting and scheduling heightened scrutiny virtual assessments. And one of the things that we want to make sure is that we're verifying and only doing assessments on those who fall into category 1 and or 2 of heightened scrutiny. We have several settings that through the self-assessment, we were not able to verify the setting status, and they were automatically marked as category 1 and or 2 because we were unable to determine if they were connected to, adjacent, on the grounds of an institution. So for several of those, we're just working with them to get picture evidence and verifying that so we can make sure we don't go out and assess settings that do not require a virtual assessment. With that being said, I want to remind everyone that has been flagged for category 1 and or 2, you have access to the two-way communication tab on the heightened scrutiny tab. That's direct access to the heightened scrutiny team. The main utilization for the two-way communication on the heightened scrutiny tab is for scheduling virtual assessments, and then, like I was describing, working with those settings that were incorrectly marked for category 1 and or 2, or verifying that they are in fact a category 1 or 2 heightened scrutiny setting. And as I say these heightened scrutiny numbers, I just want to remind everyone that heightened scrutiny category 1 are settings that are located in a building that is also a publicly or privately operated facility that provides inpatient institutional treatment. Category 2 are settings that are in a building located on the grounds of or immediately adjacent to a public institution. And then the category 3 settings are any other settings that have the effect of isolating individuals receiving Medicaid home and community-based services from the broader community of individuals not receiving Medicaid Hcbs. So like I said, the heightened scrutiny designation kind of it has a tone to it, but mainly it is due to your location. And what we are finding is that, many of the settings already do overcome or have implementations of final settings rule characteristics. It's just outlining them and making sure that the public, CMS, or those who don't know much about it have enough information to be able to agree that the setting does in fact provide home and community-based services. And we're making our way for those who have been verified as category 1 and or 2 that we've been conducting the virtual assessments with. They've been going really well, and updates that have been required of the settings have been relatively minor. And as a reminder, if a setting is out of compliance following the assessment, the setting will be required to submit a plan with timelines to the heightened scrutiny team. This information will be included in the heightened scrutiny summary that is submitted to CMS and utilized for ongoing monitoring that will occur to ensure the setting maintains final settings rule requirements. To add on to Russell's information and his team, remediation of all non-compliant questions should continue. The setting must be in full compliance with the final settings rule to continue providing Hcbs services after March 17th of 2023. The ongoing monitoring process will be utilized to ensure the policies and procedures are implemented as written and follow up on any plans from heightened scrutiny summaries to ensure that compliance has been reached. As always, the heightened scrutiny team and all teams in regards to community connections are dedicated to working with all willing and able settings to come into compliance. So once the assessment is complete, if updates are necessary and there's any confusion, we'll work with settings to provide promising practices and other suggestions for compliance that we have received from CMS and through conducting these assessments. Another reminder is that heightened scrutiny settings that are category 1 and or 2 can communicate with the heightened scrutiny team via that two-way communication feature on the heightened scrutiny tab. And then another main thing as we work into the question portion of this, it's important that any myths or misconceptions are addressed to ease concerns. because we don't want settings to worry about assessments and or closure due to non-compliance at this time. As we've discovered through review, many of you already comply, like I said, or have very little to implement in order to comply. But regardless, the purpose of this assessment is to determine that level of compliance and get you to compliance by 2023. And then finally, some of the things that we've run into is that we want to reiterate that any restrictions at a setting are person-centered. It's still necessary for behavior support plans and approved restrictions to be utilized. We want to keep in mind that the setting and its policies and procedures should indicate the least restrictive environment, and that restrictions are following person-centered support plans and behavior support plans and the likes. With that being said, that's the main information I have at this time, and I'd be glad to turn it over for the next portion of this meeting.
Thank you so much, Colin. Okay, so without further ado, we've had our updates. So it looks like the next 40 or so minutes, perhaps even more, are dedicated to questions and answers. So again, utilize the chat, utilize the raise hand function, or unmute your phone using *6. Say your name so that we can. So that we can acknowledge you, and we'll go further. It looks like we are going until 12, so we have plenty of time for as many questions as we can possibly fit. So I see a chat question, which I'll read, and then I see Chris Macy has raised their hand. So you'll be after that, Chris. Thank you. The question in chat: I may have missed you speaking about the status category, but can you explain strategy chosen? I keep receiving this after submitting my explanation or pictures. So, Russ, do you want to grab this one?
Sure, I'll take that. Thank you. Yeah, in the process, just kind of quickly, let me explain each step, and then that may help clear up a little bit, and then see if I can be a little more direct towards this question. The process was everybody who submitted an assessment that was reviewed, and remediation was determined for that, and that was sent back out to each setting. So with that, the next step is opening up the remediation tab, and in there you're going to have to do a few things. For each question for the setting, it's going to ask for a strategy, and there are some predetermined boxes there, and then that you can select to use. And then there is the other category, which that's for notifying us if you plan to do something that is different from the other predetermined checkboxes that you might be able to use. On almost every one of the questions, I believe there's a spot, that the predetermined one that says going to submit a modify a policy or procedure or something along that lines. Other would relate to you want to something along the lines of, well, you want to reconstruct a portion or change a portion of your structure. And then if you select other would need to have a approval review by a community connection staff, and you would get a response back on that. And then once you have selected your strategy and it has been accepted, then it will open a box up to allow you to submit your evidence in that box. So what happens is you've submitted your evidence through there. It goes to the community connections team for review to see if it meets compliance, and then they will respond back to that with what was good about the evidence and what still needs work. Or If it's compliant, then you'll get a response back saying that that evidence was compliant. So if you keep getting a strategy chosen response back or an email stating strategy chosen, that simply means that you have submitted a strategy, but there hasn't been any evidence submitted or uploaded through the evidence submission box. And with that, and I also do want to say, for a good majority of the questions, after reviewing a lot of them, policies and procedures are the best way that we have been able to show to CMS and provide that information to CMS to show compliance. Pictures make good supporting evidence, but for the most part, and a majority of the questions, they make supporting evidence. So I hope I've answered your question with that.
Jerry Martin.
Okay, Jerry, give me just a second. It looks like Chris, then Tammy, then you. So feel free to stay off of mute or use your phone's mute function, and we will get to you right after these two folks. Yes, go ahead.
Percy, did you say I could go ahead? This is Chris.
Yes, ma'am. Go ahead.
Okay, thank you. All right, Russell, I'm on the remediation tab because all of our settings they're listed under remediation and heightened scrutiny. So you said go to the remediation first. Is that correct?
Correct.
And then should I go under it where the column that says heightened scrutiny, or go to, is that what I click on, the heightened scrutiny column under where it says true under that on all of our category, on all of our settings? So I just click on true?
Well, you should be able to click on anywhere on that line to open.
Yes,
You have multiple settings.
yes,
So when you first go in as a provider, you're going to see all of your settings listed, and then
yes,
extra information off to the right. So anywhere along that line, if you put your cursor over any one of the settings and click on that, that should open up that settings assessment.
okay. And so when I do that, I go to, it has the questions listed, C2, 4, 5, 6, 7B. And so should we start with the ones that are orange? I've already done the red ones, but do I go to now the orange ones, or should I start with the gray ones, or does it matter?
There are 4 questions in particular that I would say to focus on, and those should be, I guess you're seeing them in orange. They show up a slight different color in mine. I call them golden brown or golden rod, but yes, focus on those. Those should be questions like, I think you said, what, C7?
Yeah, like C6 is documentation provided fails to prove whether persons served at this site are required to receive medical, behavioral, or therapy services on site. And so I would go to that and click on that, correct?
Yes, and if you click on that, that should open up that question for you to
For the
be able to.
strategy. Okay. All right. And then if I say modify policy and I click on that, then and then I have to enter a timeline, and then I save
Right.
it. Now, does the policy that I submit have to be approved by July 1st, or I just have to submit it by July 1st?
At this point, we want you to get them submitted.
Okay.
And again, with that, I want to kind of make a quick statement. It might help some other questions as well. A majority of the questions are going to come down to policies and procedures that indicate either persons served are not isolated solely due to their disabilities, and they serve and persons served have the same access to the greater community services and supports as those who do not have disabilities, which would include, like the question we were talking about, medical behavioral therapy services. They can choose those with whoever they like. They can have the opportunity to make their choices, their autonomy, dignity, respect, privacy. That all applies to all those. So when you have a policy that you want to submit for that, if you read it and it meets a lot of that process in that, that is what we're being found has worked well to be guidance for CMS.
Okay. So if we, so my question is, does does it have to be approved, or does it have to, it has to be submitted by July 1st, but does KDADS or have to approve that by July 1st? So, or it just needs to be submitted by then?
For you as a provider, we would like to have it at least submitted to give us an opportunity to review those.
But if it's submitted 2 days before July 1st, that's not enough time for you guys to review it. So is that a problem, or that's okay?
No, that should not be a problem.
Okay. And then on the settings that are, like, for example, do you own multiple sites on the same street or block? Those are in black or kind of a gray. They have, yeah, they're in black, and it says remediation has not begun. So what do I need to do with those?
You would do the same thing. You would just select those. You'd put your cursor over each question and click your mouse, and it should open each one of those up.
Okay, and so, but it says resubmit pictures, but the fact is we do own multiple settings in one block. So how do I remediate that if that is true?
Okay, so again, the best way we found, because that's not a problem, is submitting a policy and procedure that would basically state individuals are not isolated solely due to their disability.
Got it. Okay. All right. Thank you, Russell.
You're welcome.
Fantastic. Thank you, Chris. I'm going to go ahead and mute you. Oh, you got it. Okay, so we're going to move on to Tammy and then our caller. And then we have a couple chat questions, and then we're going to get to Dave. So, Tammy, by all means.
Okay. Okay, so I have a heightened scrutiny, and I think this was an error on my part in doing the assessment, but it was for C7B about there being day services on site. And I had answered yes for that, which I think I should have answered no. We're kind of unique. We're New Hope and Valley Center. We have an area on grounds that is offices, and we use one area for part of our day service. But then we have an apartment building that surrounds us right next to the middle school. I mean, it's on the same property. So I guess just a policy that the day services are not provided in residential.
Actually, the best thing to do would be a policy that, and again, something along this lines would cover quite a few of questions as well. So you could use the same policy on more than one question. You would have to submit it for each question, but you could use it.
Yes.
If you put a policy that indicates persons served are not isolated solely due to the disability.
Okay.
Because we understand that even if you do provide services only to people with disabilities, that's fine. It's just making sure that they're not being isolated solely due to those disabilities. So if you provide day and residential at the same location, not a problem. Even if you do, you just need to provide some type of policy or procedure stating that they're not isolated due to that.
Okay, thank you, sir.
Fantastic. Thank you, Tammy. We are going to go to the person who's unmuted on the phone, whose last three digits are 497.
Hello, I'm Jerry. I have been trying to get some answers, and I have not gotten any answers. I have 2 Medicaid clients. We have an office. I have gone through the self-assessment, and I didn't submit it because there was nothing in there that applied to us. We just do strictly attendant care in home. That's it. So I just, I'm asking these questions because, I don't want to screw up, but I need to know what to do.
All right, this is Russell, and so I'm going to put my email address out here so that everybody can have it, so I can specifically answer yours and take a look, have the time to take a look at what you've got specifically. And there is a process. There is the ability for some providers to be determined presumed compliant based on certain facts and aspects that CMS has allowed us. One of those straight across is financial management services, since financial management just manages the human resources type of stuff and doesn't actually do actual resident contact type of services. And then there are those that, we have to take a little closer look, maybe ask a few additional questions to kind of do that. So here is my email. Send me an email with that specific question on it. Give me a chance to reply back to you on that, and we can, if need be, we can schedule a time to talk one-to-one about everything that's going on. So here's my email. It's Russell with 2 S's and 2 L's .Bowles. That's B as in boy, OWLES @ks.gov.
Okay, is that all lowercase?
I don't think it matters, but
Okay.
yeah, I believe so. That would work.
Okay. All right. Well, thank you, Russell. I appreciate that.
Sure. Thank you, Percy.
Okay, thank you very much. We have a few that have come through in chat, and then so I'm going to read 2 from chat, and then we will go to Dave. We'll read a few more from chat, and then we will round back to Chris. So the first one is from Wendy Baker in chat. What documentation is required to prove you only serve the disabled community?
All right, yes. So with that, again, I'll refer back to policy and procedure is the best way, because we know that there are providers out there that absolutely provide only to individuals with disabilities, and that is no problem. And again, that we have found that the best way to address that is writing a policy or procedure or making changes to a current policy or procedure that does indicate that persons served are not isolated solely due to their disability, and they have the same access to greater community services and supports as those that do not have disabilities.
Thank you, Russell. Moving forward, she asks another question. Can we write a policy that addresses all of the question in the community connections?
Absolutely. you just need to make sure that you're not, one of the things that I will say when we do get to the next phase is making sure that you're not writing policies that conflict with other policies that you may have. So.
Okay, we are going to move over to Dave. Dave, if you'd like to unmute, we will take your question now, and I will lower your hand.
So my question is in regards to question C4 about having multiple sites on the same street. I have uploaded pictures to show the distance because we do not have multiple sites in the same area. So I've uploaded pictures showing the space between each site. And I don't know what the policy is supposed to say that we do not have, but the pictures keep getting rejected. So I don't know what you're looking for.
Okay. All right. Yeah, thank you, Kathy. So with that, again, we would, for the most part, the best that we've been able to show to CMS would be a policy or procedure that indicates that persons served are not isolated. So even if you do have multiple sites, or maybe there's one building in between, or you have a lot of residents in one housing structure, that policy would cover your agency pretty much across the board in that manner.
So how would that apply to the places where the agency doesn't own? So when we, support people in their own apartments, but those aren't owned by the agency.
Are you providing the service residential or billing for the service residential?
Yes.
Okay, then what CMS has been very clear to us on is that those are, in their eyes, considered to be owned or operated by the provider. So with that, again, the best way we've been able to indicate to CMS is that policy or procedure that shows that people are not being isolated solely due to their disabilities.
Thank you.
Okay, thank you, Russ. We're going to go over to the chat. We have a couple more before we get back to Chris. So, Chris, I'm sorry to make you wait. We have at least two more of these. So from chat, from Twin Valley Developmental Services, can you tell us what the 4 questions are that we should work on? I believe you stated 2. That's to you, Russ.
Absolutely. So, yeah, I am unmuted. So those questions, if they show up for you, we would prioritize these questions for heightened scrutiny category 3 in the remediation tab. If you have questions C3, C6, or either C7A or C7B come up, I would prioritize those because that will take you out of heightened scrutiny category 3 prior to July 1st. If you have a heightened scrutiny category 1 or 2, which are questions C1 and C2, make sure that you are going to the heightened scrutiny tab and communicating with the heightened scrutiny team to either clear that up or schedule yourself for an on-site, and they can assist you along with that. So I hope that was helpful.
Thank you. We're going to do one more chat question, get to Chris's question, and then we will get back to chat. So The next it says, I am finding this on C1 and C2, which I sent pictures numerous times. It comes back, strategy chosen. Not sure why, since my evidence is showing our grounds are not adjacent to or near a public institution.
Thank you. And yeah, I just looked into this, and the main thing that we're seeing, and we want to verify this, and we're making sure that providers have all they need to understand what we're looking for, I believe, is you've submitted pictures that show, you know, the front of the setting or just the setting itself, but we need an overhead to see that the surrounding places that are adjacent to are not institutional settings. So if it's in a residential neighborhood, it could just be labeled as, you know, residences. If there's other buildings, we'd want to know what those buildings are to ensure that the setting is not adjacent to or on the grounds of an institutional setting. So typically what we're seeing is just evidence that we can't confirm the surrounding areas, and the best way is utilizing the Google Maps satellite image and taking a screenshot of just the surrounding areas and labeling that. So anyone that was looking on this that didn't understand would also look at it and say, okay, I can tell that this is not connected to, adjacent to, or on the grounds of an institution. There's also resources on the Community Connections ks.org website for picture evidence that will show you some of that additional information and how to get that uploaded.
Percy, there was a follow-up question. Just
Yep.
Got it.
So not to jump ahead, but because this directly refers to what Colin was talking about, I'm going to just ask the follow-up. Sheila says, so even on an overhead view of a setting, Google Maps, for example, you still have to label the other areas around the setting, correct?
Correct. Just immediately adjacent to, because that would fall into a category 2 heightened scrutiny categorization if it happened to be adjacent to, you know. So anything that is directly around your setting, it doesn't have to be specific by any means, but just enough so we know whether it is or is not an institutional setting.
Okay, Colin, and we hope that was helpful. We're going to move over to Chris. So Chris, I'm going to lower your hand if you'd like to unmute.
Yes, for settings that we have added since the deadline of the assessments, has that opened back up to where those can be assessed, or what's the process of that?
Very good question for everyone to know is that new settings that have opened up since the assessment process began, and I believe you've went to the right place, so I'll just explain where you went to notify KDADS and the Community Connections team of that. On the homepage for Community Connections, ks.org, scroll down to the bottom and there's a notification button down there to notify KDADS of setting changes. So you do that and you can complete that. That lets us know. As of right now, new settings process, we are in discussion with CMS to approve our process and negotiate with them. So we're kind of waiting for CMS to get back with us on what they're going to accept as our process. So for right now, if you go to that location on the homepage for Community Connections, ks.org, notify us. That goes into a database so that as soon as this process opens up, we can notify all of the providers in the settings that have notified us through that process. I currently don't have a date or expected date when CMS will get back with us on that.
If it's after,
communication.
if they don't get back to you in before July 1st, we'll be okay though?
Yes, yes. I actually do not, I do not think we'll have this process in place by July 1st. So that's not a problem.
Okay, and then do we use the same process for settings that have closed or been torn down?
Yeah, you would use that same document
Okay,
on the homepage. Zane, can you put a link to that, please?
Yeah, Russell, I added a link to that form in the chat, and on that form, it is for settings that were either not assessed before 2/29 of 2020, the setting closed. It's a new site that opened after 2/29 of 2020, or there is a change in site operations.
okay, thank you.
Fantastic. Thank you, Chris. We have some in the chat that are kind of building up here, so we're going to work through them. This next one is from Denise. We have remediation questions that I believe will be remediated, marked compliant by July 1st. We have also completed the virtual assessment for heightened scrutiny questions C1 and C2. Did I understand you correctly that if we are marked compliant with all remediation questions, then C1 and C2 will automatically be marked compliant?
Thank you.
Thank you. I'll take it and then I'll turn it over to you, Colin. If that's
Okay.
all right.
Yeah.
So with that being said, no. C1 and C2, if you had an on-site assessment, there is an additional process, and I'll let Colin explain how that'll work. But you are definitely on your way. If that is the only two questions you have got left, I would just recommend continuing to check your emails and continuing to work with the heightened scrutiny team if they need any additional information. So Colin, would you like to talk some more about that process?
Yeah, definitely. And this is a great question and something that we definitely would like to clarify. So additional information, category 3 heightened scrutiny is the only category that you can remediate yourself out of, and that must occur prior to or on July 1st, 2021. For all settings that have been verified that they are category 1 and or category 2, you will always more or less be marked as that. You can't overcome the location of that setting. So the virtual assessment and completing that and getting your plan, once we have gathered all evidence and completed your summary, that is our version. KDADS has then more or less stated, we believe that you overcome or can overcome these heightened scrutiny characteristics to comply with the final settings rule. Following that, public comment occurs, and then submission of that evidence and summary to CMS. So that's for heightened scrutiny category 1 and or 2. And we just wanted to make sure and reiterate that once you finish the process and you've had your assessment completed and any necessary plans submitted to the heightened scrutiny team, you will continue all other remediation as well, but you are done with the heightened scrutiny process at that time, unless the team needs to ask for additional information, which all communications will be occurring through the two-way communications on your heightened scrutiny tab.
Okay, thank you, Colin and Russell. I hope that was helpful. We're going to move on to our next chat question. This is from Ari. If I am pronouncing that correctly, I am probably not. I am desiring to use a policy update as evidence that I have submitted on another of the questions April 7th. I was wondering how long it might be before knowing if the April 7th submission would have a response. I am hesitant to continue to use this already submitted policy further without knowing if it works on another area.
Yeah, thank you. That is a good question. We are working through the questions as quickly as we can. We have started to shift since July 1st is coming up pretty quickly. We are starting to shift our priority to make sure that we try and clear heightened scrutiny category 3 questions first. But as we're doing that, we're also looking at a lot of the questions along the way. So if you don't mind letting me know which provider you are, we can take a closer look at that, because that appears it has been at least a month, and so we'll get through that. But keep in mind, like I say, we have been reviewing almost 50,000 pieces of evidence, and that all does take a little bit of time to get there when we've got, I think we're getting close to 60,000 pieces of evidence that have been submitted. So we're working as quickly and diligently as we can to get there, but we can certainly take a look.
Thank you, Russell. We will move right on to the next question. This one is from Sheila. If a client owns their own home, is that considered agency owned or operated if we provide residential services to that person in their own home?
So simply put, CMS has made it very clear to us, pretty much no matter where the individual lives, if you are billing residential services as the billing code, then it would be considered by CMS as agency owned or operated. And in that case, it would be under the operated portion. So again, the best way to remediate through something like that is indicating a policy or procedure that says persons served are not isolated solely due to their disabilities, and that they have the same access to the greater community, services, and supports as those who do not have disabilities. Thank you.
Thank you, Russ. We'll move on to our next. As far as assisted livings, if a facility is unable to complete remediation or get their remediation plan approved, do you anticipate that there will be a reduction in assisted livings that are able to accept Hcbs services?
Thank you. So this is the question we get a lot, and I just want to make the statement that this assessment process, that where we're at in the heightened scrutiny process, is far from the transition or anywhere near like closing down settings. So we want to make sure that everyone who's participating in this process, that the assessment isn't for, at this time, a shutdown sort of scenario. We want to come out and see where you're at in regards to compliance, and work with all settings to determine, what it would take for you to implement strategies to come into compliance with the final settings rule. So in regards to any sort of anticipation or transition and reduction, we want to make sure that we have reached to everyone, that's participating in this, those who are not, and make sure that, settings understand not only where we're at in the process, but also what it will take for them to get to that level of compliance. So along with our statements of always working with those who are willing and able, we're working diligently to reach out to those who have not yet participated or may be hesitant to ensure that the process is fully understood, and that we can attain and maintain as many of our settings as we can. We want all of them, everyone, to come into compliance, so we have as many settings to help serve those that are most in need.
Thank you, Colin. Our next question is in regards to question H3, which reads, does the facility at the site have any barriers which limit access? If we do have barriers in both day services and residential services for medication security and other things for the safety of participants, would writing in the policy to explain the reason for the barriers be the best remediation strategy?
Thank you. No, the best thing to do for that would be writing a policy or procedure that says, I mean, those barriers are in place because of individuals. So that should be addressed in the person-centered planning process and not in your policies. Your policies should be addressed towards the agency to where it says that you would not have those barriers that limit access. And then you can even put in the policy any modification to this policy would be addressed in person-centered planning, such as behavior plans, rights restriction plans, any other number of titled documents that pertain to person-centered planning and processes. But policies should be at the agency level or setting level and should state that you would not have those barriers.
Okay, thank you, Russ. Our next question is in regards to heightened scrutiny. We are connected to a nursing home. How do we get marked compliant for C1 and C2? We have completed the virtual assessment for heightened scrutiny, but we didn't really get any answers, and these questions are still marked on site visit and strategy chosen.
Thank you. Yeah, with that, the heightened scrutiny team is still working. So we've completed your assessment and we're working on completing the summary. As we're doing that, we're making sure to determine that all bases are covered. And if we need to reach out for any additional information or plans to include with your summary before we post for public comment and submit to CMS, we will do that via the two-way communication. But to add to the not hearing anything, once we are complete with our process, the heightened scrutiny team will make sure to add language and a message to your two-way communication, letting you know that as far as heightened scrutiny in the assessment / summary is considered, you are done here and you may continue all remediation. So we'll make sure that there's a message there to clarify as far as the assessment part of the process. But as I stated earlier, the heightened scrutiny designations will not necessarily be marked compliant in that sense at this time. CMS has the final determination after the summaries are submitted and things like that. But when we are done with our part of the process, we will definitely let you know and also validate that KDADS believes, this setting will be able to or does comply with final settings rule.
Next one is also a heightened scrutiny question. We have received notice that heightened scrutiny 1 and 2 remediation are accepted and will be marked compliant. The message back also said, therefore, the heightened scrutiny team will work to validate the C1 and C2 questions. Please continue remediation of all questions that require updates. If all remediation, hold on one second, sorry, I lost my place. If all remediation activities are implemented prior to 7/1, you can have your heightened scrutiny designation removed, as you will have proven full compliance with final settings rule requirements. Does this mean that the rest of the questions, not heightened scrutiny questions, also have to be remediated before 7/1?
Thank you, Percy. I'll take this one. The direct response to that is no. So we're going to specifically, again, focus on heightened scrutiny questions. Those are the ones that the 7/1/2021 date specifically applies to. We do have a goal. And with that, I mean, we all have to set nice goals for us to make sure that we stay on track with our timeline that we need to meet for CMS. So if you are able to submit your questions for all of your, the rest of the questions for the setting, we will try to review them and look at them, but unless they are heightened scrutiny category 3 questions, you do not specifically have to have them completed by July 1st of 2021. With that being said, the sooner that you do continue working through the process, the sooner that we can determine compliance for your settings, and then we can all take a deep breath. So thank you.
Okay, we only have a few more questions, but I know that we've been going at this for a little while. I want to make sure that we take about a 5-minute break. It is 11:05 right now. So let's come back at about 11:11. And so we can have kind of a one function break, get a drink, stand up, stretch, maybe test out some of the emails that have been put in the chat. But we will be back at 11:11 and we will finish out our chat questions and address any more questions that come our way. Thank you. We'll be back in a bit. All right. It is 11:11. We are going to go ahead and get started again. I'll start off with something that Latanya has put in chat. Latanya states, if you are working on remediation and or heightened scrutiny with community connections, you will be okay regarding deadlines as we can show your engagement to work toward compliance. We ask that you submit a strategy and evidence for at least one setting by 7/1/21. Those that complete these actions will be on the priority list of validation and desk review and move into compliance and ongoing monitoring first. Those who do not engage by 7/1 will be lower on the priority list and risk loss of funds if they are unable to meet compliance by 3/17/2023. Thank you, Latanya. I appreciate it. See if I can remember where we were at. Here we are. So this next one, let me make sure that we don't have anybody raising their hand. Okay. This next one in chat is from Sheila. If we did an assessment initially on a setting and clients moved and no one uses the setting anymore, can we use the form? Do we have to continue to remediate or do we stop work on that address?
Thank you, Percy. Well, that's kind of a two-part question, because do you have to continue to remediate for that? No. But with that being said, if you're a provider and that is your only address, we highly recommend that you continue work on that and remediating through that, so that you would not have to start this process from the beginning if you wanted to open a setting up later. So that does give those that have had settings a little bit of an idea for that. If you have multiple settings and this is just one of them and you've got several other ones, then it is completely your choice if you want to stop remediating on that particular setting. And you could just go to the homepage of the communityconnectionsks.org and submit for a site removal, and we will review that. So if we see anything that catches our eye on the site removal when we're looking through those, we will reach out to you anyway. So we do appreciate that. Thank you.
Yeah, and I was going to
Go ahead,
say also
Colin.
to follow up with that, and because we've come across this before, if perhaps, you know, you might serve HCBS in that setting by 2023 or any time in between or after, it's always recommended to just complete this process so you already have that either road to or that compliance setting So you don't have to go through this process if by chance, in 2023, you'd start to serve HCBS members at that setting, you would need to complete the process before.
Thank you, Colin. Jennifer followed up talking about her previous question, and I think that was addressed. The place that she was talking about or referring to was category 1 and 2, but incorrectly categorized in this way. Big shout out to Ori, whose name I did pronounce correctly. Okay, so moving on to our next chat question.
Percy, can I
Yes, sir.
interject real quick?
Please do.
Base, so that I make sure that we're clear. And Colin, if you could follow up with this as well. I just want to make sure when we are looking at heightened scrutiny category 3, it is those sites that are heightened scrutiny category 3 only. So that is where you're also very important if you feel you were misidentified as heightened scrutiny category 1 and 2 to communicate with the heightened scrutiny team. But when we talk about the July 1st date, if you have had an on-site assessment, yes, we would still like you to get the rest of the remediation completed, but that's actually going to go on a different list. So, Colin, can you maybe interject a little here too?
Yeah, for sure. So for the scenario, kind of to add on to, I'll lay out kind of both. So for the one scenario where you have the setting that was originally marked for category 1 and or 2, but you verified evidence and the team let you know that you are not in fact a category 1 and or 2, that designation is removed. And so you've continued remediation. And if you're a category 3 only, like Russell said, that it's a CMS hard deadline, that 7/1 of 2021, to have the heightened scrutiny designation for category 3 removed. So that's when those heightened scrutiny 3 questions need to be remediated prior to 7/1/2021. Category 1 and 2, that's a continued process, and like we said, we'll have to conduct that virtual assessment and provide a summary that's submitted to CMS. We'll need to have plans for anything that's gone on there, but implementation timelines can be set out a little further. But before I confuse anything, I just wanted to reiterate that for category 3 only settings, those are the ones that we're really pushing to have the remediation strategies completed by 7/1/2021 to have that designation removed. And then for those who do not, you will just continue remediation, but your setting will be marked as heightened scrutiny category 3 and require additional assessment by CMS and others.
Thank you, Russell and Colin. Hope that provided some clarity. Russ, did you have something you wanted to add?
No, just being prepared.
Okay. Our next, if we need to change the remediation strategy that was originally selected, how are we able to do that?
If you have selected a strategy and you've received a response back from that, or if you were opened up from your strategy and allowed to submit evidence, I wouldn't worry at this point about the strategy. Just continue moving forward with your evidence and working with the remediation process in that. So hopefully that helped with that. So like I say, if you've already selected a strategy, you really don't need to go back and select another strategy. We are focusing on the evidence because the evidence is what will remove you or show the compliance process. Thank you.
All right, thank you, Russ. Next question here. Okay, it looks like it's a follow-up from Jennifer. Thank you for the clarification. The message indicated that if all others were remediated, we would be removed from heightened scrutiny list, which was in conflict with other messages I understood. Am I missing something? Does heightened scrutiny category 3 also need remediated before 7.1, not just to category 1 and 2? We have 2 questions left with evidence still waiting to be accepted, and we would be fully out of heightened scrutiny.
Yeah, I think we covered that one. Unless there was still additional questions from Jennifer in that regard.
Okay, Jennifer, if this is cleared up for you, go ahead and message something in the chat. If we need some additional clarification, please let us know. In the meantime, I will read Alyssa's while we wait for Jennifer to respond. Oh, all good now. Thank you so much. So our next and final chat question that we have so far is, if we have an individual that moved to a different apartment within the same apartment complex in the community, do we complete a removal form and then notify the community connections team of a new site?
The answer to that would be yes, because a new apartment is a new setting or site. So yes, you would need to do that. With that being said, I'm going to go back to the statement of, if you have multiple settings that are similar, submitting a removal will not make much difference. If you do not, if this is your only setting or site, then we would be reaching out to you anyway once we know work through the site removal process. But yes, you would need to go into the homepage for Community Connections, ks.org, scroll down towards the bottom and notify us of the status for both sites. So you might need to do this twice for each setting, one for the new setting and one for the setting you'd like to remove. Thank you.
Thank you, Russell. And again, the form is back in the chat, courtesy of Zane May. Thank you very much, Zane. Feel free to click on that form and just kind of navigate through it to check it out if you are in need. What I have done, because I spend a very large amount of time looking at these forms and kind of navigating through, is I will put this on a favorited website of mine. That way I can navigate to it quickly in case I need it. But having all of that said, we have gotten through our chat questions. I don't see anybody unmuting or raising their hand. I want to make sure that we have a little more than 30 minutes left in our call to answer any questions, to field any comments, anything like that. So I want to make sure that I give people ample time and energy to do that. So I am going to now officially stop talking and let people come up with their own questions or comments. Does it look like somebody has unmuted?
Yes,
Go ahead.
my name is Emma, and I have a question for you. Do all
ahead,
these can some of these questions be answered as a standalone answer with having a policy and procedure? Like, for instance, some it's a yes or no answer.
No. No, there needs to be a policy or procedure. Any of the questions that show up in remediation need to have some form of evidence submitted and not just yes or no.
Okay, that's what I need to know. Thank you.
And I will put out also, and I'll leave it up to LaTanya if she wants to put her email out there, but we have no issue whatsoever for individuals that policies and procedures are not their forte and they need assistance with some of that stuff. We will make ourselves available to assist you with the basic concepts and stuff for policies and procedures and kind of what needs to go in. So with that, if you're needing that kind of assistance or wanting that kind of assistance as well, again, my email was in the chat earlier. I'm sure Zane would be more than happy to put it in there again. I will restate it. It's russell.bowles, B as in boy, OWLES @ks.gov. And we can schedule some time to help you guys get through those if you need to. So, like I say, we're here to help walk the path towards compliance.
Hi, is anybody waiting for a question?
We do have one person who has unmuted, Leah. So let me get to that person and then you can go next.
Okay, thank you.
So the person who unmuted's last 3 digits are 185. It's a 316 number. Go ahead.
Yes, my name is Carolyn. I'm assisting with Love, Confident Care. My question is kind of like a piggyback off of Ms. Emma's question. So even though we don't do yes or no, we can't answer just yes or no, can we make reference in the, we will be making reference in the policy manual as to where that yes or no is implied, correct? So will we need to upload the policy manual again, or we just need to upload the portion in the policy manual that pertains to that yes or no question?
That's a little, we accept both. If you have a portion of your policy, we would need to make sure that there, each page of that portion is identifiable as a policy, which would have who your agency is, what the policy
Correct.
refers to, dates of the effective date it goes into place or revision date. Or we are even accepting, because we do know that some providers have a lengthy policy approval process. If you, instead of a date, if you type in the word draft, we will look at that. Keep in mind, we will expect that to continue through the process once we look at it and it makes it through the compliance process. So, yeah, we can do that.
All right, that helps. Thanks.
Perfect. Thank you. And Leah, I believe you are next.
Okay, I just have a specific question for our, we were to heighten scrutiny for the C7 question for both our day and residential. So vice versa, it says, do we provide day services in the residential setting? And then do we provide residential in the day service settings? I thought our policies were clear when, how we stated and the evidence that, that we provided as far as the pictures showing, it's just clearly a residential setting, and our day services are actually all community-based. We don't even have an actual building that we provide those services. So I guess my question is, what would you recommend for additional evidence to get out of that heightened scrutiny category?
Okay, so you, if I heard correctly, you said you have submitted a policy for those. So that may be just, and I don't have yours up presently to look at exactly what was submitted for that question. But again, a lot of the policies and procedures that we have found have covered a lot of that is basically the same premise that would cover questions such as C4, C3, C5, those type of questions that do talk about not person served not being isolated solely due to their disability. So with that, and then our reviewer, if they see something in the policy, they should be responding back to you with what was good about your policy, as well as with what may still need some work. If we still need to discuss that a little further, please contact me.
Okay,
Email.
sounds good. Yep. Thank you so much, Russell.
Wonderful. So we still have some more time for questions. We don't have anything in the chat. Do we have anybody either unmuting on phone or who is needing to ask a question who's joined us via their computer?
So personally, while we're waiting, I've got a few of them that have come to us over time that since we've gotten them more than once or twice, I thought maybe we could just put it out there. It might stimulate a few additional questions. One of the things is, this is a question that is in reference to both remediation and heightened scrutiny. And it is, if somebody is in heightened scrutiny and is in need of a virtual assessment, they have completed a good majority or all of their remediation, with the exception of those C1, C2 questions that would be triggers for heightened virtual assessment. So the questions that kind of comes across is, what if I already have something compliant in remediation and the virtual assessment disagrees? In essence, what is being looked at, and Colin, please jump on board here to elaborate a little further, but when we are looking at documentation in the desk review or the remediation portion of the tab, that is documentation, that's policies and procedures. When it gets more towards the virtual assessments, a lot of times they're looking at how those policies and procedures correlate to practice. So is it actually being put into practice? So I think that is good to know. Colin, if you have anything, please.
Yeah, no, that definitely covered it.
Thank you both. There are some more. Russell, do you have any more that you wanna talk about?
Well, I do want to explicitly talk about, there is a question in there, or a couple questions that talk about locks, doors, things like that. And I know specifically with a lot of our adult care homes that are providing home and community-based services, we've had some question about, well, there's not a lock on the bathroom door, or misconceptions that, well, we have to put this heavy major massive lock on here to meet compliance with final rule. And that is again, that's a myth. With that, what we look at is that individuals need to, one that we look at is that as far as locks, locks would be the outer doors or entrance into their living area, their personal space, their living space. So that could be in reference to, if they have a bedroom, it'd be their bedroom door. If they have like a master suite where they have a bedroom and a bathroom that's attached to that, then the bathroom would not need a lock, because the entrance door has the ability to provide them with that privacy and dignity that they would need mostly for personal hygiene and care, but would also be able to provide them with that privacy and dignity in communication and utilizing communication devices, even if that's a pencil and a piece of paper. I know we start thinking about all our tech devices now. So I just wanted to clarify that they are not specifically needed on bathrooms, provided that that is not a community bathroom. If it's a community bathroom, you would need some form of a lock device. With that also being said, the final rule is not in conflict with Life Safety Code, which is usually reviewed by the Kansas Fire Marshal's Department or office. And if you have questions about what types of locks would meet that Life Safety Code, I do recommend please reach out to the Fire Marshal's office, and they would be more than happy to discuss with you what type of locks would meet that Life Safety Code and still be compliant with final rule.
Okay, Russell, thank you. Thank you so much. Still looking for folks to either put something in chat or to unmute your phone or computer. If you're going to unmute your phone, it will be using *6, and your computer down there at the bottom of the Zoom call, there should be a microphone which you can click and unmute yourself. So it looks like Jennifer has put in the chat, there will be practice learning curve. Some gray areas will need confirmation of KDAD's acceptable modes of operation. Example, if an individual lives in a home with another individual who needs a restriction, will it be acceptable to give options to bypass the restriction to the person who does not have the need as written in their plan, such as giving them a key to a locked fridge?
Thank you, Percy. And Jennifer, yes, you are definitely on track with that. And there are also, there are a lot of, I've found in discussion with and visiting other states that are implementing a lot of this stuff right along with us. So keep in mind, there are 51 other states that are, or territories that are working through this process just like us. And there's been some really cool tech stuff that's come out that seems to be or can be a little less invasive in appearance. And since we've got a little bit of time, I'll just kind of touch on a couple. Is that I know a lot of people maybe have seen those little bracelets that, you know, rubber looking bracelets with the little watch that looks like that, tells time, stuff like that. A lot of those are, you can get those and they work a lot like like for us, when we want to access our office, we have a key card, we swipe it in front of a sensor and it would unlock the door to our area. But if we're trying to go into an area that we're not allowed into, then the key card is not coded to allow us access to that. So with that being said, there are technical devices that can work like that as well. Because yes, I'm quite aware, I've worked direct care with individuals and keys get lost, misplaced, sat down, things like that. So just things to think about in working towards the future. But yes, old school method, key, lock, refrigerator, those do work. Just make sure they are in the person-centered plans for all residents. So you're correct. There's a learning curve, keeping in mind those residents, like you mentioned, if there's residents that do not have that restriction, how are you going to provide them the ability to have the access when they want it? And that would be in the person-centered plan.
Thank you, Russell. Sorry, I had to scramble to unmute there. Okay, so let's check our chat and our room one more time. It does not look like anybody is unmuting or raising their hand. And there's nothing else going on in chat. We have a little more than 15 minutes left. We have actually gone through a lot of, so we had some kind of preloaded questions here, but a lot of the interaction from the providers have really covered some of this stuff. So I don't know if there's anything that we even have here to yeah, we touched on so much today. Go ahead, Russ.
I was just going to say, just to reiterate that we are aware of some of the questions. The intent of the question has slightly changed now that we're in the remediation process. And the evidence that you would provide does slightly change. And that's why we wanted to make sure that everybody understands policies and procedures are the preferred method to allow us to show CMS. And when you do look at a question, if you do keep in mind that the intent of a lot of questions is to help us determine whether a person served may be being isolated solely due to their disability, and the policies and procedures would explicitly show that they have the same access to the community services supports as individuals without. So it kind of changes the direction of a question. And so we just want to make sure when we discuss this or have a chance to let everybody know that that has occurred with a few questions within the assessment. And if you keep that concept in mind, that will help you get through a lot of those questions more easily.
Thanks, Russ. So just to kind of piggyback off of what you said, I love the idea that, especially during this call, we've really stressed not only folks who are trying to remediate questions, but folks who, they have answered yes. So I think it was Chris Macy who was saying that for one of the questions that we've answered, we do own multiple places on a street or block. So, what do we do there? And I just want to kind of remind everybody that it is okay to have, just because on the self-assessment we've marked things as non-compliant, it doesn't mean that we expect everybody to do the exact opposite of that question. So there was a sentiment a while back that on that question specifically, that we were expecting folks to move residences, and we were expecting people to uproot their person served, and that's not the case. There are concerted efforts to make sure that despite whatever is going on, whatever yeses that may be, that people aren't being isolated solely due to their disability. So I want to kind of underscore that, because there may be some despair with some providers thinking, well, this is an answer that is non-compliant. We're not going to change that. So does that mean we have to close down, or does that mean that we're going to get penalized in some way? And the answer to that is no. We absolutely just want to make sure that persons served are not being isolated because of whatever that yes is. So if it is that you have multiple facilities on the same street or block, we want to make sure that there's some efforts being made to show that persons served are not isolated because of that. If it's whatever, I mean, there are a few of them there, question-wise, that may be a yes for you. We're not asking that anybody tear anything down or build anything up in terms of their facility. We just want to make sure that there are things representative in your policy and your procedure that show that despite whatever may be going on, that people are not being isolated or kept from the larger community. of that. So just want to make sure that's kind of being underscored as we come to the close of our meeting. It is just a very important thing that we want to make sure every provider has a chance to understand. Are there any further questions, concerns, or comments regarding remediation, heightened scrutiny, the process? My hair, it's luxurious and glorious today. Anything else that we want to kind of touch on before we part ways in about 10 minutes? Nobody wants to talk about my hair? Nobody here. Let me take it down so you guys can see. Look at that. Okay, I'm completely kidding. We are coming into a close to our meeting today. We will have another one of these meetings. Zane, help me out with it. It's next Wednesday, is that correct?
That's correct, May 26th.
So registration for these meetings are full. However, if you have some folks that you think could benefit from these question and answer style sessions, please send them to the chat or the Hcbs team email, and we'll go ahead and put that in the chat so that folks will know. It is hcbs.team@wichita.edu for those of you who are listening in on the phone. Again, that is hcbs.team@wichita.edu. So having all of that said, we have been very, very happy to extend ourselves and to help out with any questions that you may have. If you are signed up for next week and you've come to this session, you can also come to the next week one. There's absolutely no problem with that. So with that being said, Colin, Russell, Latanya, Zane, Sarah, any closing comments you guys want to make?
I just made a quick announcement in chat that we send a survey after this, and it includes a section folks can ask additional questions if they think of something later or they want something cleared up that they heard here in this session. So please complete that survey when you get it. It'll come to your email within a few business days.
And call and also in person for responding to those. And yes, Jennifer, these recordings will be uploaded after we have our last one next Wednesday. We'll get them all uploaded to the website.
Latanya, you were a little robotic, but I got what you said. So I want to repeat what Latanya said just to make sure for folks who might not have heard her, because I don't know what's going on with your connection, Latanya, but you were a little, it was muffled. We will be putting out the recordings of these after our last session on May 26th. So we will be making these available for folks. And then she just kind of thanked the team and all of you for coming together. Thank you to Zane, to Russell, to Colin for answering questions and making themselves available. And then thank you for those of you in attendance for making time and spending your energy getting these questions out there. And hopefully this helps people kind of walk down the road to compliance a little more at ease. And if there's any other things that we can do for you, our resources, our chats, and our emails are all available in the chat here today. All right, everybody, with that said, we have 10 minutes. You can take 10 minutes back of your day. Enjoy the oncoming afternoon. And hopefully we'll talk to you again when everything is compliant.